Hi, my name is Amy Raworth. My student number is S327037.
Okay.
The course is Health and Social Care with a foundation level, and the date is the 21st of the 11th, 2025. And this is the role of vaccination policies in managing infectious diseases. I would just like to start off by saying, unfortunately, Samina and Saida, due to unforeseeable circumstances, had to submit their part of the presentation separately. This did affect our ability to work as a team. However, also, due to Susanna being in the hospital and being unable to participate fully in the assignment, we have each worked to the best of our ability to complete the full assignment and work together to get it completed on time. And I'll be on with my presentation now. So vaccines are a type of prescription-only medicine. The purpose is to stimulate a person's immune system to produce antibodies that fight specific disease so that a person develops an immunological memory. It enables the immune system to recognize and respond to it rapidly, thereby preventing or modifying the severity of the disease, as quoted by the House of Commons in 2022, the UK Vaccination Policy Research Briefing. That being said, the structures are put in place to ensure infectious diseases can be contained throughout a population and prevents an immunity throughout pandemics, such as the most recent COVID-19, which left the globe in one of the greatest pandemics the world has seen since the flu pandemic, which began in Hong Kong in 1668. Regardless of the fact this disease had seemingly low mortality rate, which was only 5%, it still claimed the lives of more than 1 million people. Since COVID-19's global pandemic, we've seen a rise in public hesitancy towards immunisation and vaccines. This can delay the success of vaccination programs and eliminate swollen diseases. Since the pandemic, we have been looking at the post-COVID landscape, which, through information obtained by Saracen Partners, reshaping of consumption and investment, a move towards financial dominance, and a sustained retreat from globalization, sometimes called walled gardens.
So yours is finished, Amy, yeah?
Yes, yeah.
Right, okay. Yeah, thank you very much, Amy. And now we'll invite Susanna to speak on her slide, which is slide 89, yeah? So if you can start your speech on your slide, Susanna.
Hi, my name is Susanna Ngyokata. My student ID is S326837. I'm sorry for the background noise. I'm in a hospital right now, and I'll try my best to speak louder. The topic I'll talk about is the role of vaccination policies in managing infectious disease. Role of health and social care professional is to delivering vacancies protect individuals and communities, and educating them on how it can help them prevent outbreaks can also reduce disease spread. Second one is to trusted relationship enable practitioner to provide information in a way that is meaningful and accessible. Addressing hesitancy also requires an understanding of its underlying causes, which are often multi-faced with personal beliefs, cultural norms, and past negative experience with service. Third is to clear communication pathway are essential for effective collaboration. Regular meeting, secure information, sharing tools, and clear roles. This is aligned with the GDPR and safeguarding to ensure safe and coordinate multi-agency work. Department for Education 2018. And the second one is practical strategies for improvement. Mobile vaccination units and pop-up clinic bring vacancy directly into communities, especially rural, deprived, or hard-to-reach areas. Reduce barriers such as transport difficulties, work commitment, childcare needs, or mobility issue. And the second one is digital appointment system. Let patient book and manage appointments online, improving access and convenience. And reminder text or email reduce missed appointments and support more efficient use of health service. Reference is Albert A. ETAL 2019, Journal of Medical Internet Research 2110 E14427, Guy RETAL 2012, Health Service Research 47, page 614 to 632. That's all. Thank you.
Okay, thank you, Susanna. Thank you for your contribution to our team. And let me try and put my slides on. The last topic. Have you both seen the slide? Yeah. Have you? Okay, welcome. My name is Peter Ndiokata, and I'm the last slide for our team. Obviously, there's three of us in the team. What Emmy have just said before from the introduction, and it's only three of us at the moment, so it is what it is. So my name is there, Peter Ndiokata, student ID S327037, and my slide is slide 10, 11, and 12. The role of vaccination policies in managing infectious disease, as we can see on the slide in front of us. And the first subtopic, that is the organizational responsibility, or the responsibility that organization have with regards to this, the role of vaccination policy in managing infectious disease. The first one is it's embedding vaccination into routine care pathway. What it means, it offer or gives or presents vaccine during regular GP or pharmacy or hospital appointment. Or in other words, when the patient, they come for their regular GP appointment, there are a number of vaccine that is being offered or presented to them with regards to the case or infection or whatever infection they come up with. And also it check vaccination status at every patient interaction of regularly. It's also a use of reminders and follow-up through standard clinical systems. It also train all healthcare staff to identify vaccination opportunity. It make vaccination a normal expected part of patient care. And so then the next one is the policy recommendation. It's aligned vaccination with the broader prevention and health equity goals. It integrate vaccines into routine preventive care, screening, and wellness visits. It also used vaccination program to address chronic disease, maternal health, and aging needs. It prioritized community with historical access barrier or disproportionate disease burden. A partner with trusted community organizations, schools, and employers. It collect and use disaggregated data and close equity gaps. And the last one is ensure cost, transportation, language, and cultural needs are not barriers. And to conclude with this short presentation, vaccination policies are central to infectious disease control, as it can, one, it prevent illness before it occurs. Vaccine stop infection rather than only treating them. So it is very important and vital to take vaccine because it stop infection rather than only treating them. And the second one, it reduce transmission at the population level or widespread of transmission. Fewer infection hosts means fewer outbreaks. It also creates herd immunity. It protects infants, immunocompromised people, and other unable to be vaccinated. It also limits severity and complication. Even breakthrough infections are milder. So it also prevents healthcare system strain, fewer hospitalization, emergency response. It contains epidemic quickly and predictably. Policies ensure rapid, coordinated action. Cost effective as well, public health strategy, far cheaper than managing large outbreak. And the last two, it strengthens health equity. Universal access prevents disproportionate harm and marginalized communities. And the last one, for the importance of vaccination policy, it reduce pathogen evolution. What it means, it fewer infection means fewer opportunity for variants. And that is come to the conclusion of our team presentation, and the reference of this information that has been derived from is there at the bottom of the slide. And I'm trying to zoom out for this so we can see. But anyway, it's there for the for the reference of our slide. And that is the end of our presentation, our team with Amy, Susanna, and myself. We thank you very much for your time.
Thank
And
you.
thank you very much.